So welcome back everybody. Can you please punch whether the voice is loud and clear? Can you please punch? Is it audible? Yeah. That's right. Sorry for a short interruption and thanks for patiently waiting. Can you give a little time? Yeah. Good. So Srilata, Jitendra, Devanshi, Roshan, Ranjit and everybody, sometimes बड़े बड़े देशों में छोटे छोटे mistakes होते रहते हैं. That is where the technology is. Yes. Now we finished this question. Oncogenic rickets is not seen in which situation? We should remember that it is not seen in chondroblastoma, whereas osteosarcoma, non-ossifying fibroma, angiosarcoma, in all this there is a production of a fibroblast growth factor 23, which has got a phosphaturic effect just like the parathormone is what you have to basically remember. Now, question number 4 in the today's Tambola of the NEETPG Orthopedics, how good you are prepared. So please punch your answer, doctor. What do you see in Maffucci syndrome? Question number 4. Sushmita says A, Devanshi also, Prithvi also, Nisha also. I will ask you 5 questions in each high yield topic, and at least if you can get 3 out of 5 correctly, you are ready with that topic, and if you are not so, quickly go back to the UMedico app and revise. That is our deal. Okay. Seema, Madhushri, Manya and everybody, that's good. Thank you. 93 of you are all online with a short interruption we had in the beginning. That's good. That's good. So you should remember, Maffucci is enchondroma with hemangioma is what you have to remember. So this is, tomorrow's examiner may give you a radiograph where you should recognize the enchondroma, and with that you should think of a possibility of a Maffucci syndrome. So this is another example of a patient who had Maffucci enchondroma plus the hemangioma. Okay. Now, which is called a biphasic tumor. The last question to call yourself as PhD in bone tumors for the NEETPG exam. If you have done 5 out of 5, I am the happiest person over here. Very good. Question number 5. I can see Ravi proposing synovial sarcoma, Jitendra proposing osteosarcoma, Madhushri supporting by saying osteosarcoma, Lovedeep Singh is proposing synovial sarcoma. Lovedeep, Jindabad. So 5th question, Lovedeep is absolutely right. So any of you have scored 5 out of 5? Raise your hand in the first topic of bone tumors. Without a question on bone tumors, NEETPG 2019 nahi hoga. Excellent, Kulkarni Sai Charan. I am very happy. 4 by 5 is a very good score. Ranjit also 4 by 5. Excellent, doctor. So this is a monophasic and this is a biphasic form of a tumor, and that is a property of the synovial sarcoma is what you have to remember. Now, doctor, the second sure short topic, अगर पैसे लगाए तो किस घोड़े के ऊपर आपको रिटर्न ऑन इन्वेस्टमेंट मिलेगा बोले तो congenital talipes equinovarus is the topic of the day which you should be very sure about. Hold your breath, get ready to answer 5 out of 5 in this second high yield topic for the Orthopedics NEETPG 2019. Early CTEV, how do you want to treat it? Is the question. Question number 6. Should your answer? Very good. Ravi, you scored 4. I am proud of you, baby. Now, we have Dr. Vikas proposing D. Everyone is saying D. Ravi is standing on A. Jitendra is saying C. Let us see. Computer Mahoday bol raha hai. Manipulation and corrective splints. Both of them for the early CTEV, manipulation and a corrective splint. So manipulation and plaster of Paris, you all know what is a kite's philosophy. The foot is treated with a plaster of Paris beginning at the age of 1 month. And what is the sequential order of correction, doctor? A, I, E, All India entrance. A for adduction first. Uske baad adduction, All India entrance. I is inversion deformity. And after that, equinus deformity. That is the order in which the correction is done, is what you have to remember. Question number 2, in the topic of congenital telepo-equinovarus. What is not true about the CTEV shoe? आप tomorrow AIPG एग्जाम, आप NEETPG में जाते ही, कमरे के अंदर जाते ही, पहला घूंघट निकालते हुए देखना है, मेरा CTEV रेडी है, मेरा बोन ट्यूमर रेडी है या नहीं. You should be very sure. और एग्जामिनर शर्माते हुए बोलेगा CTEV का कैसे आपको ट्रीट करेगा. Then you should give a confident answer. Question number 7. Everyone is saying straight outer border is a wrong answer. Very good, doctor. So it has no heel. There is a raised outer portion used only from the age when the child starts walking. They're all the true statements. This is how the CTEV shoe looks like, is what you have to remember. There is a straight inner border, not an outer border, to prevent the inward movement of the foot. There is an outer shoe is raised in order to prevent the foot inversion, and there is no heel to prevent the equinus, is what you have to ultimately remember. Question number 8, the third question in the second most high-yield topic, CTEV. Most common cause of CTEV क्या होता है? Most common cause of the CTEV क्या होता है? Once more examiner पूछेगा आपको CTEV के बारे में. Aparna is saying idiopathic, sir. Patient is pathetic. Doctor is idiotic. Right? Absolutely. All of you are agreeing? Right, very good. Lovedeep is saying idiopathic means it should be only idiopathic. So, commonest being equinovarus, second most common is calcaneovagus, and typically idiopathic are most common, is what you have to remember. So, fundamentally what is the problem? Why certain paralytic conditions lead to development of CTEV, doctor? If the inverters and plantar flexors are stronger, then the everters and dorsiflexors, that muscle imbalance is responsible for the development of the CTEV, is what you have to remember. Ponisetti method is used, Italian Ponisetti, you should not forget. It is used for what purpose? Easy question. We are talking about CTEV, right? Good, good. Aparna, Anjum, Ravi Kumar, Dasari, everyone is saying CTEV. Absolutely right. So the Clubfoot treatment is done over a period of 4 to 6 weeks, is what you need to remember. So if you internally rotate the calcaneo-cuboid navicular complex, when the talus is plantiflexed, then that is the method by which Ponisetti can be able to bring a balance between inversion and the eversion, is what you have to remember. So then question number 5 in CTEV, give me a strong answer, doctor. What is except about CTEV? CTEV. Fadafat bolo. Question number 10. Question number 10. Ravi proposes A. The talus is the only bone involved. Is wrong. Dasari Sushmita is also equally competing, betting on the horse called option A. Very good. Aparna also. Arebab. Monica is proposing C. So, when majority of our Janta is saying A, this is a democratic country, except Sunil Kulkarni and Monica are forming a special Kutami with the answer C, but Maha Kutami is not winning. What we can do, right? So, you should remember, doctor, navicular and forefoot are typically shifted medially, and neck of talus is also affected. Body of talus is rotated outward. Posterior part of the calcaneum is held close to the fibula. So, multiple bones are the ones which are involved in the CTEV. Excellent! Kulkarni, Purnima, Lavdeep, Jindabar. 5 out of 5. That means forget about CTEV. Anything about CTEV, I will guarantee you, in NEETPG 2019, you are ready. 5 out of 5 is a tremendously wonderful score. Okay, doc. Now, the third definite question, paper out, NEETPG 2019. What are the tests in orthopedics? एक क्वेश्चन अगर ऑर्थोपेडिक्स में एक टेस्ट के बारे में नहीं आए तो NEETPG में 2019 Murali Bharadwaz will change his name. Okay, Charlie Chaplin Gate. Where do you see it? Question number 11. Question number 11. Should your answer? Very good. Sunil Yadav, Akash Rai, Ranjit, Sudha Shukla. I am very proud of you. All of you. 4 by 5 also is a very good score. You need not worry. Forget about CTEV. And then go ahead. Wherever your scores are falling below 3 by 5, you have to be doubly careful. Right? All of you are saying B. Jitendra is standing on A. So don't be biased by others' opinions. Just feel what you felt is appropriate, right? So that is very important. It is a apne aap ki introspective test. That is what I am trying to tell you. So you should remember that Charlie Chaplin guide is typically seen in tibial torsion. All those who answered B, but yeah, whenever there is a tibial torsion, classically Charlie Chaplin guide is very classical, right? Now, Lachman's test is positive in which situation? Is the next question of the examiner. Question number 12. Garma garam answer de do. Lachman's sign is positive. In which condition is the question of the examiner. Ravi is proposing andric cruciate. Alex thinks it is medial meniscus. Dekho, itna asani question Alex said, you have to be tasman jagrata jagrata, like what the saint Shankaracharya has said, right? So, Biswajit Sahu is also thinking anterior cruciate, absolutely right. So, Lachman may, when andric cruciate is injured, you will get excessive gliding anteriorly whenever you are trying to glide it, which is called Lachman, is what need to be remembered. Now, positive Trendelenburg sign is seen in the paralysis of which muscle is a beautiful question. Yeah, this question is going to pull your leg, right? Question number 13. Sushmita, Ravi are betting on medius. Okay. Should your answer? Anjum, Anuj Nigam, Biswajit Sahu. Only Yasmin is thinking Maximus. Maximus. I'm not asking where do you give intramuscular injection, right? Very good. Gluteus medius. Medius. Maximus is the most common wrong answer, right? Very good. So, gluteus medius is what you need to remember. That brings us to the end of our topic number 3. अगर 5 out of 5 if any of you have answered, right? 5 out of 5. You can forget you are the Mahagyani of the tests in orthopedics. The next topic is hyperparathyroidism. I am very happy. Kulkarni, you made it 4. Another Kulkarni, Sai Charan made it 5 by 5. Ravi is the king of all. Score 5. Very good, very good. Excellent, excellent. Now, subperiosteal bone resorption in hyperparathyroidism अगर आप देखना है तो कहां जाके देखेगा is a very important question. Question number 14. Shoot your answer. Sushmita is proposing radial border of middle phalanx. Ravi thinks lamina dura. Upen thinks radial border. Very good. Kulkarni says C. Lavdeep said C bhai. If Lavdeep said C, answer C ही होता है, right? Excellent, excellent. So, acro-osteolysis and subperiosteal bone resorption typically along the radial border of the middle phalanx is the classical location is what need to be remembered. So, the brown tumors and salt and pepper skull, any of these can come in the tomorrow's NEETPG exam out of the 20 questions in orthopedics. Okay. So, if you are doing 3 out of 5, not 4 out of 5 or 5 out of 5, you have to go back to the U-Medico app. Fadafat khatam karo. The high-yield topic discussion, DNB mein, etc., etc., so that you are confident about the topic of hyperparathyroidism. That is the whole idea. Okay. Salt and pepper appearance, subperiosteal resorption, etc., etc., and brown tumor, as what you can see. Examiner can give this as a radiograph in the tomorrow's exam. Now, serum acid phosphatase is increased in which bone condition is a very important question. Question number 15. Fatapat answer bolo bete. 15. Sean Chaco, don't dishearten. Go back and review the topic of hyperparathyroidism in the U-Medico app. Right. So, Vanilla is proposing hyperparathyroidism. Lavdeep बोल रहा है पेजेट्स और एक बार सोचो. अनुज निगम कह रहे हैं hyperparathyroidism. Roshan Yadav is proposing पेजेट्स. Hyperparathyroidism में classically you have the rise of the acid phosphatase. Then the question number 16. Short 4th and 5th metacarpal. Classically, where do you see? Question number 16. Yes. Ravi thinks hyperparathyroidism, right? And Maunika is also thinking pseudo-hypoparathyroidism. Monica, I am coming to America to meet my girl Monica. Recently a very famous song, right? So Monica, answer is short and 4th, 5th and metacarpal in pseudo-hypoparathyroidism. Very good. Pseudo-hypoparathyroidism. What is pseudo-hypoparathyroidism? Hypoparathyroidism नहीं रहता, मगर all skeletal abnormalities of the pseudo-hypoparathyroidism अगर है तो उसको खाली skeletal abnormalities रहे तो उसको कहते हैं pseudo-hypoparathyroidism is what you need to remember. Now let us go to the, so this is example, short 4th and 5th metacarpal. Classically is a, tomorrow examiner may give you only this as a image and expect you to answer it like a pseudo-hypoparathyroidism is what need to be remembered. Another example of short 4th and 5th metacarpal, which can be a spotter in the tomorrow's NEETPG 2019. Now doc. So that brings us to the end of 4 topics. मैं तो पेपर लीक कर रहा हूं आपके लिए. टेंशन नको लेना. आप कैसे करना प्रिपरेशन? Today is what? 28, right? 29, 30, 31st, 3 days, and you are having 7 more days, 5 more days, 8 days, okay. 8 days बोले तो you have 16 half days. Every half day में एक सब्जेक्ट खत्म करना है. कैसे खत्म कर सकते हैं? First you get a diagnostic MRI from me, right? आप क्विज भी खेल सकते यू मेडिको में. अगर हाई यील्ड टॉपिक में 10 क्वेश्चंस आंसर का क्विज आप खेले तो अगर आपको इफ यू आर गेटिंग लेस देन 8/10 स्कोर, वो टॉपिक को जाके आप रिवीजन करो. एंड इन द क्विज फीचर इन यू मेडिको you have all the topics arranged in the descending order only in every subject. So you play, know that you are not able to do it good, 8/10 nahi aa rahe, then you have to read that. That is how you can remember, and you can within short time can make a revision. Now doc, fracture of distal tibial epiphysis with the anterolateral displacement. Ankle fractures, favorite topic. 5th question, compulsory without ankle fractures. अगर 2019 NEETPG में नहीं है तो मेरा जिम्मेदारी है, वीडियो रहेगा, मैं भी रहूंगा और एग्जामिनर भी एग्जाम में भी आपको मेरा याद आएगा. क्वेश्चन नंबर 17, फटाफट बोलो. रवि इज प्रपोजिंग टिलॉक्स, अलेख से बोल रहा है कॉटन्स, Maunika is saying pots. बढ़िया. अपर्णा is betting on D. अभी पूछेंगे कंप्यूटर महाशय आपका सोच कैसे चल रहा है. It's called Tillock's fracture. So Thakkar, Devanshi Thakkar, Lavdeep Singh, Rocket Trader, Jindabad. So this is an example of a Tillock's fracture, where the distal tibial epiphysis is fractured, as you can see here, and along with that there is anterolateral displacement of it is what you can be able to see. So this is a Salter-Harris type 3 fracture, where anterolateral tibial epiphysis is the one which got fractured, and it is commonly seen in older adolescents classically, is what you need to remember. Now, how do you manage congenital pseudoarthrosis of tibia is the next question under the ankle fractures, for that matter ankle and bones around the ankle fracture. Question number 18, shoot your answer doctor. MS Vishwanathan is proposing D. Excellent, excellent. MS is proposing D. 169 online, strong students across the country. I'm very happy. If we leave this video by night, another 2-3 hours, there are about 1100-1200 views. I'm so happy. Those who could not participate in the class during the live session, they are able to participate in the late part of the night. So I said, until NEETPG exam, let us not delete the video, let us retain the video, right? So that let us do what best help that we can do, even though the students have not subscribed to the U Medico. So after your exam, those who have not subscribed, so you will definitely get a wonderful seat. I love to see you to get the seat. And even if you have not done well in the exam, don't worry. We are always there with you every day evening. I am promising you, until I have energy, I will be there to until you get the seat. Okay. So answer is D. That is vascularized fibular graft is what you need to remember, which is the classical answer. So he is multiply operated and failed congenital pseudoarthrosis of the tibia, which is caused by the neurofibromatosis. And this is how a congenital pseudoarthrosis of the tibia typically looks like before surgery, and 50% of cases it is the neurofibromatosis is what need to be remembered. The next question in the topic of, oh, very good. Gurjar, welcome back. Now, lot of new students are joining from Ukraine, China, Philippines and many more places from January onwards to attend the pre-session every day. That's good. Question number 19. Sai Maunika is proposing D, compression fracture, and Sudha Shukla is proposing compression fracture. Very good. And Anuj Nigam is proposing compression fracture. Excellent, excellent. Absolutely right. It is compression fracture, which is classically on the fall of the foot. What the calcaneum gets is an example of a compression fracture. It is also called Don Juan's fracture, where there is a burst compression of the lumbar spine along with the fracture of the calcaneus together is called the Don Juan's fracture, is what you need to remember. Now tell me, how many of you answered 5 out of 5 in the ankle fractures topic? Koi answer kiya kya? But it is 5th topmost high yield topic that is there in the examiner's question bank in the NEETPG. So, Ravi said 4, excellent, I am happy. Shubham said 2, no worries. Shubham Gupta, just go back immediately to the UMedico app and then review the videos on the topic of ankle fractures. 5 minutes में आप expert बन जाएगा. Maybe it is about 20-minute video. 20-minute lecture video, फटाफट revision करो, that is very important. Okay, doc. The next high yield topic by the examiner, you have to answer 5 out of 5 in this. So, what is that? A vascular necrosis. A vascular necrosis for patients, you can retard it by what dosage of the calcium daily is a very, very important question. Yes. Question number 20. Yes. Sai Maunika, Shubham Gupta, Gulam Bhatt, you are all differing between B versus C. MS is proposing A. Purnima thinks it as C. Wow. So much of variation, right? Because dosage is a stupid single liner. So, 1500 milligrams of calcium daily, doctor. Those who answered C, Jindabad. Pain in hip, limp after a prolonged high dose of steroid for bronchial asthma. Classically, what is your diagnosis based on the history? Straight away, tomorrow's examiner is going to ask you in the NEETPG 2019. What is your answer, doctor? Question number 21. Ravi is proposing a vascular necrosis. Deep Singh also is saying the same. Excellent, excellent. Super dupero, a vascular necrosis. Alcoholism, steroid therapy, sickle cell disease, renal dialysis, anti-cancer drug, postpartum necrosis, Gaucher's disease, Kaison's disease, everything. Causes of the AVN is a frequently asked question. And what are the 5 points you want to remember about AVN? Bilateral, most of the time, pain in the groin, X-rays will be normal in the early stage, you have to do a bone scan, and supinolateral part of the head, not the infero-medial, is the most commonly affected part of the femoral head is what you need to remember. So, all these high yield points are available in the UMedico notes, doctor. Don't worry, you can set up a reminder if you are forgetting, right? So, please give me a feedback. How are the notifications on the UMedico for your reminders? Are you getting the notifications regularly that this point you have set reminder every 15 minutes? One notification keep coming to you on those slides which you have set up a reminder. Please tell me, are you all getting the reminder slides in the UMedico app or not? Question number 22. Thank you. It is working good. I am happy to know from Shubham. Very good. If you have any slide problem in the app or any new features you want, you can always call our helpline. Okay, that's good. I see subcapital, most of you. But Gulam Bhatt is proposing subchondral. Yes. And I can see some of you are saying yay. Very good. I can see 187 online online students. Yeah, very good. It is subcapital. Hawkins sign. What does it denote? Tomorrow's examiner's mesmerizing question to you on the avascular necrosis. Like a Hawkins cooker, your answer should come out. Yes? So, question number 23. Most of you are saying D, but Sudha is sticking on retained vascularity. Retained vascularity. Ravi Thakkar is also supporting. That's good. Retained vascularity. Sudha, congratulations. Right? I'm very proud of you, baby. That's good. So, you can see this is the Hawkins sign. So, subchondral lucent line that you are able to see indicates there is a normal blood flow in the talar body. So, it is a sign of a retained vascularity is what you have to basically remember. Badia. So, Sudha, you can forget about avascular necrosis of the femur for the next 10 years, right? Which carpal bone? See, at this moment, remember one important principle, doctor. Don't defeat your own soul. You say, you look into mirror while brushing and say, hey man, what a wonderful guy you are. Huh? You're doing good, man. That is what you should say. Don't go before mirror and say, मुझे मिलेगा क्या? नहीं मिलेगा क्या? मैं पूरा time बर्बाद किया ना. Don't say that, right? So appreciate yourself because you have really worked hard across the year. So, and this is the time where lot of institutes conduct mock tests. आपको 20,000 rank, 30,000 rank, 40,000 rank data. Give a damn shit to the ranks which have been given to you. Don't care about it, right? If you know you are potent, you know you are potent. You need not go to a red light area and then check whether you are potent or not before going to a nuptial night, right? So, mock test sometimes just before entrance exam also is like a young man going to a red light area to check his potency. So, don't do that. So, if somebody said that your rank is 30,000, 40,000, don't give a damn shit to that. I have seen many instances, students who were getting very poor ranking, they get disappointed, depressed, even the little time left also, they will unnecessarily spoil that time. So, there is nothing that we need to worry about, okay. Now, the question is, it is the scaphoid. It is the scaphoid is what you have to basically remember. So, this is the scaphoid which is most prone. So, that is the topic number 6. Anybody got 5 out of 5? 5 out of the 5 is a very important question in this topic. Yes? Please punch. Very good. Ravi got 4. Mitesh got 3. Ranjit got 5 by 5. No problem. And Alex said need to just improve a little bit. From 2 by 5, he should become 5 by 5. It is only 10-15 minutes. If you know where you are going wrong, you correct it, it doesn't take any time at all. Now comes the next shoot shot aane wala topic in the NEETPG 2019 in orthopedics. Named fractures. फटाफट बोलो आपका ज्ञान in this English antonyms, synonyms, acronyms. Jones fracture किस जोन पे होता है? Question number 25. That's good. Vipul Chaudhary got 5 by 3. Super. Now, MS is proposing yay. That's good. Ravi Thakkar is saying C. Very good. Most of you are saying yay. It is the avulsion fracture of the base of the 5th metacarpal is what you have to remember. Straight away doctor, tomorrow's examiner will show you one Jones fracture का x-ray दिखाएगा और पूछेगा बेटा तुझे जोन मालूम है या नहीं है, नहीं तो you are not in the NEETPG zone, get out बोलेगा, right? So be very sure. You may be knowing that it is an avulsion fracture of the fifth metacarpal, but you should recognize which is the metacarpal, carpal, and which is the fifth and which is then called first. Always thumb is first, big toe is the first, and little toe and little finger are fifth. I know that, you know that, but still. So you have a stress fracture, Jones fracture, avulsion fracture. All these favorite site is typically located in the fifth metacarpal is what you have to, metatarsal is what you need to remember. Motor cyclist fracture किसका नाम होता है? Question number 26. Shoot your answer, doctor. 26. One confident answer. Ravi बोलता है B. Okay. Monica is saying A. Lovedeep is saying B. Ankita is saying D. Yay! Most of you who said B, clean bold. Who said A? Who said A? Somebody said A, right? Gaurav Jain said A. That's good. That's right. Right. Very good. Very good. Very good. So, typically, motorcyclist fracture, the base of the skull will break into two halves, the left lateral and the right lateral, which is basically called the motorcyclist fracture, is what you need to basically remember. Now, doc. Essex lopresti is a fracture of, oh my god. Essex lopresti is a fracture of. थोड़ा इटालियन भी आना पड़ेगा अगर आपको MD MS में ज्वाइन होना है तो, right? So question number 27, right? Oh, Oberoi is saying, sir, it should be B. Oh, can you please connect me to the, I lost the power for the laptop. On कर. Is it on? You just check properly, put the. Yeah, it's coming. Just a moment, doctor. Yeah. Yeah, yeah. Ranjit is saying, yeah, yeah. Just give me 1 second. Screen before the. What's working here at the rate? Yeah, sorry for a short interruption. Okay. Yeah, I think the Anterior and posterior halves, is it there in the, into two halves? Anterior and posterior, sorry, I think B should be the answer. Okay. There is a small correction, B should be the answer. Okay, what is Essex Lopri? What is this? Lopresti. 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 Question number 27. I can see B. Oberoi is saying B. Most of you are saying B. That's good. That's good. The radial head with interosseous membrane. The injury is called as Essex Lopresti, where there is a dislocation of the distal radio-ulnar joint with a disruption of the interosseous membrane is what you need to remember. So, how many of you get, the earlier question was B, not A. Yeah. What is your, who got 5 out of 5? Please give me some good news in my ears. 5 out of 5. Yes. 193 online. I am very good. Good to see. 4 by 5. Excellent. Oberoi, Ranjit, Priyanka. Very good. Now, shoulder dislocation. Hip dislocation, shoulder dislocation के बिना अगर orthopedics में question paper है तो how many, I don't know how many questions are there in orthopedics in NEETPG, doctor, according to the prospectus. I think 10 or 15. There should be somewhere like that, right? So, without a question on shoulder dislocation, hota hi nahi question paper, right? That's good. Mitesh is saying 10 questions, okay. Topic number 8. Be ready. Which nerve is closely related to the shoulder joint capsule is a very important question. Oh, nowadays they mixed it with surgery. Okay. Question number 28. Roger बोलता है axillary nerve. Excellent. Yes. Excellent. Everyone is 100% confident on axillary nerve. Hill-Sachs lesion कहाँ दिखता है आपको? Simple question. अगर answer को इसका wrong करे तो you have to, nothing. There is, even if you do wrong of this answer also, tension कुछ भी नहीं है. Sai Monica is proposing A. Everyone is saying B. Right? So, it is anterior dislocation of the shoulder joint is what you have to remember. Gurjan was thinking D, right? And Nischal is thinking C. Oh. So, what are the pathological changes in anterior dislocation? You have a banked lesion here, and it is in the lower part of the labrum where you are having that avulsion which is called banker, and you are having classically the Hill-Sachs lesion, and it is typically there in the posterolateral aspect of the head of the humerus is what you need to remember. Now, the next question. Hill-Sachs lesion. Where do you see is the question. Where do you see is the question. Yes. Hill-Sachs lesion. Yes. Shubham Gupta is proposing C. Okay. Most of you. Excellent. Posterolateral part of the humeral head. The next favorite topic of the examiner, you should be 100% sure in the tomorrow's exam, is brachial plexus nerve injuries. Definitely a question milega. Let me see how good you are in this. Claw hand. Where do you see? Simplest, easiest. Biscuit. Biscuit question. Skating करते हुए answer करो. गुलाम भट्ट बोलता है ulnar nerve injury. Monica, I am coming to America. That's right. Ulnar nerve, absolutely. Vishalakshi is also saying ulnar nerve, absolutely. So this is the typical claw hand. Then One more important point is there about ulnar paradox. If it is a high lesion, then you expect a more severe deformity, but there will be lesser deformity. Whereas only low lesions, there is a clawing. Clawing is fundamentally because of the action of a flexor digitorum profundus which is intact. But if it is a high injury, even flexor digitorum profundus is also paralyzed. That is the reason the deformity of clawing will not be seen in high injury. A higher injury, you expect it to be much more severe, but deformity is less severe, which is called as the clawing, ulnar paradox is what you have to remember. So, a lot of times examiner is going to ask you, which muscle being intact is responsible for the clawing at the time of the ulnar injury? What is your answer? Flexor digitorum profundus के वजह से clawing दिखता है. That is very, very important. Now, doc. Yeah. Medial epicondylar fracture results in the injury of which nerve is a very important question. Question number 32. 32. Yes. What is your answer for question number 32? Medial epicondylar fracture. Ravi Thakur cannot do mistake on such a simple question. Maybe it is a typing mistake. Right? That's good. Ulnar is what you need to remember. After the injury at wrist, a patient's hand is being shown to you, and what is this because of? I say simple questions ही होता है nerve injuries में, but 5 out of 5 अगर आपको नहीं आए तो आप फिर जाके इस टॉपिक को रिविजन करना. That is very, very important. Okay. So what is your answer? That's good. It is the ulnar nerve injury. So that is the story of nerve injuries. But I asked very easy questions actually. 5 by 5, most of you might have got 5 by 5. But you have to compulsorily review it. There is a 35-minute video in the high yield topic discussion videos. Please take a quick chance if you are feeling little uncomfortable on this topic, which is a must to review topic for the tomorrow's NEETPG 2019. The next topic in the top 20 topics, the countdown is on hip dislocation. What is your, let me see, आप कितना strong है, कितना माहिर है इस topic में. Vascular sign of Narad. Where do you see is my question to all of you. Very good. Purnima Jaiswal, बहुत खुश है बेटा that you made it 5 by 5. Very good. Yes. Question number 34. Ritvik Kanumuri is saying posterior dislocation. Posterior dislocation. Ranjit is proposing posterior dislocation. Excellent. Excellent. Madhu, oh mere Madhu, you cannot do answer as C. C to wrong hai. Sudipti, mera heart break mat karo. You should not answer it as C. Yeah. Now, please don't forget, whenever posterior dislocation is there, then the femoral artery will become feeble, sometimes absent, which is called the vascular sign of Narad. Is what you need to remember. Fenestrated hip prosthesis कौन सा होता है ये आइटम्स में? जल्दी बोलो फटाफट. ऑस्टिन मूर होता है या डॉम्सन होता है या बाइपोलर होता, किसको होल्स बना के फेनिस्ट्रेटेड हिप प्रोसेसिस कहते हैं? मोनिका, क्वेश्चन नंबर 35. रवि थिंक्स ऑल. ओके. ऋत्विक थिंक्स only Austin Moore. Sushmita thinks Austin Moore. Excellent. Rohan thinks all. Madhu, oh Madhu, you are absolutely right. Austin Moore. So, typically, if you look at the bipolar hip prosthesis, which is fenestrated model, it looks like this. And this is the Austin Moore's prosthesis, which is a fenestrated one. This is the Thompson's prosthesis. And Austin Moore versus Thompson क्या होता है जरा एक बार देख लेना, right? So hip dislocation, you should be 100% sure, doctor, right? I'm very happy to see Sangdu Sherpa from where are you from? Sangdu Sherpa must be from Nepal, right? Yes. Osteoarthritis. Tomorrow orthopedic surgeon बनने के बाद what is your bread and butter? आप लोगों के नी जॉइंट के कार्टिलेज के ऊपर जीना पड़ता है. So you must be 100% sure in osteoarthritis, right? Now let me see how good you are for the NEETPG osteoarthritis. Most common deformity seen in the case of the osteoarthritis क्या होता है? Osteoarthritis. Very good. Ranjit, in the last topic you are 5 by 5. Proud of you. That's right. Now, question number 36. Ritvik Karumuri is proposing genuvalgum. Alek is thinking genuvarum. Sudha Shukla, Yadvinder Singh from Ludhiana, they're all proposing genuvarum. Absolutely. Genuvarum group, Jindabad. So, this is a normal knee, and when the space between the two bones is narrowed down, this is how the osteoarthritis typically looks like. Knee is most common joint involved, and this is the genuvarum deformity that you see in the case of the osteoarthritis is what you have to remember. Very good. Sherpa, you are from Nepal. I am very proud of you. Now, this is the genuvarum, the bow leg, and this one, that's most common. Then the other one is genuvalgum, etc. etc. This is genu recurvatum, is what you should appreciate. And commonly asked MCQ, you will remember me in tomorrow's exam. TB knee में what is the triple dislocation बोल के examiner पूछेगा, आपका आंसर क्या होगा? Flexion, external rotation, lateral subluxation is basically called as triple deformity, my good fella. Fella क्या होता है? F is flexion, E for external rotation, L for lateral subluxation is what you need to remember. Now, doctor, Osgood-Schlattler's disease is an osteochondritis, which is involving which part is a very, very important question. फटाफट बताओ गर्मा गर्म आंसर for Osgood-Schlattler's disease. Tibia is proposing tibial tuberosity. Priyanka is also saying A. That's good. Very happy to see 195 online students. Anjum Khan is proposing tibial tuberosity. Seema also. Badhiya. हम बहुत खुश हैं. So, all osteochondritis you have to review, doctor. Osgood-Schlatter is typically pain and inflammation in the patellar tendon attachment point of the tibial tuberosity is what you need to remember. So, that brings our topic number 12, the high yield 20 topics shoot shot for the tomorrow's NEETPG 2019. How many of you answered osteoarthritis, chondritis topic में 5 out of 5? Ravi, very good. MS Orthopedics, पहला हड्डियां तोड़ के बाद में जोड़ने के लिए रवि तैयार हो रहा है to become Ravi MS Orthopedics. Beautiful, beautiful. Now, sciatic nerve injury. Let me see how good you will answer. Sciatic nerve damages most commonly. Which nerve is a very important question. Very good. Roshan Yadav, Rocket Trader, Vipul Chaudhary, keep it up. You are good in osteoarthritis. Don't care about this topic until NEETPG exam. Already you are good. I am giving you ISO certificate. Okay. Now, I can see Sudeepti proposing iatrogenic. Iatrogenic. Upin thinks traumatic due to injections. That's right. Soumya thinks iatrogenic. Yes, always when iatrogenic is there, idiopathic will be most common is what you need to remember. Now, nerve which is involved in the foot drop, which one is that? Is the examiner's question. Nerve involved in the foot drop. So, Monica is proposing, Sai Maunika is proposing C. Okay. Alex Seth is saying B. That's good. Very good. And Seema is also proposing B. Absolutely. Common peroneal is what you need to remember. It is the superficial peroneal. Motor function of it is foot eversion. Deep peroneal, foot dorsiflexion and toe extension is what you need to remember. Now, doctor, meralgia paresthetica typically involves which important nerve injury which lead to excruciating pain in that obese patient who had been put on the bed for a long period of time. After getting discharged, while getting discharged, she says, lot of pain along, I'm going to give you the answer. That's right, along the lateral aspect of my thigh is what she will say. And the answer is lateral. Actually, lateral cutaneous nerve of thigh is correct. Please correct the answer. Right. There was a repetition of the question. That's the reason answer was wrongly given. Now, the next sure short topic for the examiner out of the top 20 for the examiner. That last moment, this is very important, doctor. What are those 3-4 topics? Like a son returning from America to see the father passing away on the ventilator. इसको क्या बोलते तेलुगु में आखरी चूपू बोलते. आखरी चूपू बोले तो हिंदी में क्या बोलते I don't know. Last time you are seeing somebody before they are taken to the funeral, right? So हिंदी में क्या बोलते भाई? Last time आप जो देखते ना किसी को before they are taken to funeral, what is that called in Hindi? Counterpart of आखरी चूपू in Telugu, right? So ये जो टॉपिक्स जो हैं अंतिम करेक्ट, कुछ टॉपिक्स का अंतिम यात्रा है, उसको गुड बाय बोल के बोलने का अंतिम दर्शन. करेक्ट, एब्सोल्युटली राइट. एज अभिषेक व्यास सेड, ये अंतिम दर्शन की वक्त आ गया है कुछ टॉपिक्स के लिए. टुमारो व्हेन यू क्रैक द एंट्रेंस, आई एम टेलिंग यू, यू विल बी लाफिंग. अरे बाप, स्लो सैंड फिल्टर का सैंड पार्टिकल भी पड़ा है भाई बोल के आप सोचते हैं, राइट? Tomorrow you will become a top cardiologist, you will be meeting your other buddy mates and you will think, oh, those days we used to even read that chlorination. कितना है रे percentage बोलते? 33% या 55%? Then your other cardiologist will say, forget about that रे, हमारे stunt में कितना cut मिल रहा है, वो भी 33 या 55%. That is important in the today's life बोलेगा. So that is it. So this is the antim darshan. If you are not getting at least 4/5 in this Antim Darshan program, then you have to just quickly revise it, right? What's the spine? Commonest in which part of the spine is an important question. Question number 42. 42. Should your answer, doctor? Yes. Question number 42. Should your answer? Very good. Yeah, I am able to see 199 online. That's good. Most of you are betting on option A. That's good. Option A. That's good. Thoracolumbar, doctor, even by mistake, don't say lumbosacral. You said, if you answer this wrong, no, TB spine, really you ignored, you need to go back and read. Okay, good to see Abbas Khan, very good. Spina ventosa is a name given to the radiographic picture of what? What is spina ventosa? Question number 43 is an important question. 43. Yeah. Sushmita is proposing tubercular dactylitis. Most of you, excellent, excellent, excellent. Raphael also is saying the same. Okay. Vandan, clean bold. So, spina ventosa का मतलब स्पाइन नहीं होता है वंदन. Tubercular dactylitis को याद रखना. That is very important. So, this is a tubercular dactylitis presenting as a fusiform swelling of the finger with ulceration. Tomorrow it can be a spotted along with radiograph examiner can give you where you have a osteolytic lesion because of the TB is what you need to remember. Now, commonest spine involved in the TB is thoracolumbar or dorsolumbar. So, lower thoracic more than lumbar, more than upper thoracic. Then paraplegia in port spine commonly involves upper thoracic vertebra. The main reason is there is more acute kyphosis, spinal canal is narrow and spinal cord is relatively larger, typically in the upper thoracic area, and that part of the spine is the one which is compressed, leading to the development of paraplegia. Then another common question. First common symptom of the TB spine. फटाफट आंसर बोलना. एग्जाम हॉल में सोचना मत. Pain on movement classically, which you should remember. If you ask you a question, commonest symptom of the TB spine, the answer is back pain is what you have to answer. So I leave the literature. Just take 2 minutes of break. We will rejoin in another 2 to 3 minutes. Yeah. Please stay online. Hello. Yeah, welcome back. So, welcome back to the session, doc. Bony ankylosis occurs in all these scenarios except which scenario is the examiner's question. Question number 44. Ritvik is proposing rheumatoid arthritis. Pranahit Reddy is proposing TB. Abhishek is saying arthrogyposis. Oh, very wide variety of answers. Milram ko. Devanshi is proposing TB. Good. So you should remember septic arthritis. Fibrous ankylosis is common outcome of the healed TB of the joints. Only exception is the spine, where spine TB lead to bony ankylosis. But septic arthritis classically leads to bony ankylosis, and the most common cause of the bony ankylosis, that's the reason Ankita Tripathi Jindabad in this typical point. So you can see that there is a bony ankylosis in the healed TB in the spine is what you are able to see. The next topic out of the 20 topics which are the favorite of the examiner is Oakman's ischemic contracture. Aruna says then answer should be wrong, no? Why? Bony ankylosis occurs. Oh, I'm sorry. Bony ankylosis occurs in all except was given, right? Then it should be TB of the joints, because TB, tuberculosis of the, I think the question was not well framed. I'm sorry for that. Question should be bony ankylosis, most common cause should be the best way of asking, right? Yeah. B should be the appropriate answer in this given scenario, right? Topic number 14. Oakman's ischemic contracture. Let's talk about this topic. Prominent sign of the Oakman's ischemia kya hota hai is the examiner's question. Yes. Alex said, that's what I was thinking also, that arthrogryposis may be fibrous hota hai. So, that frame of the question need to be altered. Question number 45. Sudipti is proposing D. Very good. Nishchal is proposing B. Okay. And Monica is also saying B. Pain out of proportion is the correct answer, where it is the most prominent sign whenever the symptom, which is very significantly high pain out of proportion to the expected amount of injury, that becomes a Oakman's ischemia. What is that muscle most commonly affected in Oakman's ischemia is the examiner's question. Question number 46. Let me see how good you are Oakman compliant for the tomorrow's exam. Ravi is thinking FDP. Rituraj is also thinking FDP. That's good. Excellent. But Ankita is thinking flexor carpi radialis. So FDP, Ankita should go back and quickly revise the topic of Oakman's ischemic contracture. Commonest cause of the compartment syndrome kya hota hai? Question number 47. Should your answer, doc? 47. Oakman's ischemic contracture, once more, a favorite topic, compartment syndrome, BIC, all more or less the same story. Yes. So Ravi is thinking fractures, and Rachan is also thinking fractures. Aarti, little slowly joined, but at least joined at last. That's good. So it is fractures. Now what is an indication for you? How much pressure? To relieve the compartment syndrome case, the absolute pressure greater than how much is the question of the examiner. Question number 48. Ravi, पहला हड्डियां तोड़ के बाद में जोड़ने के लिए Ravi MS बन के आ रहा है. You should all be ready to see Ravi joining MS Orthopedics. Ravi, do you like MS Ortho? What is your dream branch? Question number 48. I can see 30 millimeters of mercury. Soumya is clean bowled. Prithvi Patel also is clean bowled. So, doctor, a rise in the pressure jeopardizes the blood circulation and forearm bone fractures, closed tibial fractures, crush injuries, supracondylar fracture, they are all the ones which are risk factors. And the stretch sign is one of the earliest signs. If you stretch passively, there is a production of pain, and any pressure higher than 40 millimeters of mercury is basic of water is considered to be a significant one, and depending upon the pressures, normally the pressure in the compartment is less than 15 millimeters of mercury is what you have to remember. That's good. Topic number 15 out of 20 in the Agni Pariksha for NEETPG 2019 in Orthopedics. Right? You should be ready. Let me check how good you are. Carpal tunnel is caused by all these underlying causes except. फटाफट बोलो आपका आंसर. Question number 49. Should your answer? Yes. Monica is proposing pregnancy. Oh. Yes. Oh my God, Ravi, you are also thinking pregnancy. Come on. Right? Very good. Most of you said rightly. TB में नहीं होता. Hyperthyroidism, pregnancy, acromegaly. Pregnancy is a very common cause for the carpal tunnel. Idiopathic is most common. Obesity, OCPs, hypothyroidism, diabetes. Diabetes also very common predisposing factor. Now, carpal tunnel syndrome में which nerve is not involved out of this? Question number 50. Should your answer, doctor? Another 10 days में you're all going to attack the story of the examiner. That's good. 200 online students. I am very happy. So, if you liked this session, खाली like मारना, like तो compulsory. Please punch a like on the YouTube. Tell also your friends to come and join every day evening. Across the year, we are going to be with you to support you free. But at the same time, if you liked the class, support it by paying through the Paytm to the number which is being given to support the class. It's a voluntary kind of a support. There are a lot of teachers. Some teach freely. Some like to be paid for what they teach. And some exorbitantly charge for what they teach, but we don't encourage such teachers. Some decently charge to teach. We always encourage them to come on the floor because they are all professionals who teach. So, for this free class, if you like it, please support by paying through the Paytm, right? Paytm or the other payment methods to the number given to you in that slide. So, which is not involved in carpal tunnel. So, you should remember neither ulnar nor radial, neither of them, but the median is the one which is involved. Phelan's test, where do you do, is the next important question. Question number 51. 51. Very good. I can see already a good number of students who have sent 100 rupee donation to the today's class. Thank you very much for supporting this class. Yes. Every day across here, we will be there with you to add a little more, 2 more cents of inspiration for you to continue to prepare, right? So, Phelan's test is done for is the next important question, 51. So, I can see question number 51, very good. Rahul Khanna is proposing carpal tunnel. Absolutely. So if you happen to flex together, then the tingling sensation, right? Ulta namaste, hota hai felons. The next topic, 16th topic out of 20 topics you have to remember in the tomorrow's exam. अगर fracture of humerus आ गए तो oh my god नहीं बोलना. You should attack it. You should know 10 points about fracture of humerus which examiner want to know, right? Let me check how good you are. Fracture shaft of the humerus causes the damage to which important nerve is a very important question. Question number 52. Very good. Thank you. Around 36 students have paid, have made a donation for the today's evening class. I will also display the 36 students who have made a donation. Thank you very much. Now, fracture shaft of the humerus causes the damage to. Question number 52. Very good. Akash Rai, everyone is saying radial nerve, because the lower, there is a radial groove also. Excellent. Fracture of the surgical neck of the humerus leads to loss of abduction movement of the corresponding shoulder joint because of the injury to what is a very important question. Question number 53. Question number 53. Sudipti, Ravi Kumar, Sai Maunika, Priyanka, everyone is proposing C. That's good. C? Yeah. Axillary nerve. Absolutely. Axillary nerve damage is caused by the damage to what? Is a very important question. Question number 54. Should your answer, doctor? Fadafad. Garma garam topic will be the fracture of the humerus for the examiner. Ravi is thinking surgical neck of humerus, but Vandan is thinking shaft of the humerus. Shaft of the humerus पे क्या होता है? Radial groove होता है, radial nerve injury होता है. So you should remember it is the surgical neck of the humerus. The next hot topic for the examiner out of the top 20 topics in the tomorrow's NEETPG is fracture of the spine. So fracture of spine में अंतिम यात्रा करेंगे, अंतिम दर्शन करेंगे fracture of spine को for the NEETPG 2019. If you get 3 out of 3 or 5 out of 5, then you need not worry. Compression fracture is commonest in which part? Question number 55. Ravi Kumar is proposing A. Monica is proposing B. Soldier of Mewar is proposing D. I love this name, Soldier of Mewar. Very good. So, Rafael is proposing C. Abhi dekh lenge. Absolutely. Rafael, Jindabad. And Pranahit Reddy, Jindabad. And yes. So, lower thoracic spine, doctor. Most common site of the compression fracture is at the thoracolumbar area. T12L1 is what you need to remember. Yahan dikh rahe na? T12L1 is a classical location. You should not do this wrong. Once more, the examiner is going to ask you. Right. C6, C7 cervical spine fracture का नाम क्या होता है? C6, C7 cervical fracture का नाम क्या होता है? Question number 56. Should your answer, doctor? 56. Question number 56. Yes. I can see, yes. Clay Chauveler is a, yes. Clay Chauveler, yes. Absolutely right. Clay Chauveler is the one. So what is this fracture called as? This is called as chance fracture. Chance fracture is what you are able to see here. A chance fracture is a flexion injury of the spine, whereas a compression injury to the anterior portion of the vertebral body is what you have to remember, along with a transverse fracture to the posterior element of the vertebra, the combination. Now, doctor, this is a hangman's fracture. What is hangman's fracture? Both the pedicles of the pars interarticularis of the axis vertebra is called as the hangman's fracture, is what I want to underscore to all of you. Now, Holsworth classification of the thoracolumbar spine fracture is based on how many columns of the spine is the examiner's question. Question number 57. फटाफट शूट करो डॉक्टर, आपका स्पाइन के फ्रैक्चर की अंतिम दर्शन करो. Raphael is proposing B. That's good. Raphael is proposing B. Arti also. Good, good. So it is 3 or 2. 2 or 3. Yes. Alex said तो गर्मा गर्म आंसर दे दिया. 2 column. Holsworth is a 2 column theory. Dennis is a 3 column theory in the spine fractures is what need to be remembered. Then what is the hot topic? Topic number 18. What are the top 20 garma garam topics? Meniscus injury is what you have to be very sure about. Arthroscopy is contraindicated in which important condition? Question number 58 is a important question. 58. Ravi is proposing chronic joint disease, and most of you are saying hemophilia. Hemophilia. It's a common sense answer. Absolutely right. Oh, denotes triad. Indicates the injury of which ligaments of the knee is going to be the simple, easy question. Provided meniscal tumors में अगर आप पंडित है तो फटाफट आंसर करेगा आप. अगर इसका रॉन्ग करे तो आप इसका अर्थ क्या है कि आप just go back to the U Medico Act and revise the meniscal tear. That's good. I can see most of you answering B. Medial collateral anterior cruciate in medial meniscus is what you have to remember. The unhappy triad where the hit to the lateral knee will lead to a combination of the injury of MCL, PCL and ACL, ACL, the medial meniscus and medial collateral ligament. Now doctor, what is the terrible triad of elbow? Same. Elbow dislocation along with the fracture of coronoid, along with the fracture of the radial head. What is meant by terrible triad of shoulder? It is the traumatic dislocation, which is anterior, rotator cuff injury, along with the brachial plexus injury. For that matter, most of the shoulder dislocations anterior होता है. But exception case क्या होता है? Epileptic seizures is the situation where, or electroconvulsive therapy whenever you give, shoulder dislocation is posterior is what you need to remember. What is not included in the unhappy triad of Ogdenogh? Once more, that is the only issue along with few tests for the meniscal injury. Easy topic, 10 minutes में revise करने वाला topic होता है. Question number 60, excellent. Most of you already know it, that it is lateral collateral ligament. Then the topic 19 out of 20 for the Antim Darshan of Orthopedics before NEETPG 2019. Rheumatoid arthritis के बारे में बोलो बाबूजी. Most common part of the spine which is affected by rheumatoid arthritis क्या होता है? Let me see how good you are in this. How good you are in this. So these 20 topics को आप last moment में जरा ध्यान देके इधर उधर भागने का जरूरत नहीं है. एक जगह पे बैठ के शांति से which topics you are too good, which topics you are not good very much, उस जगह पे आप you have to make a revision. That is very, very important in rheumatoid arthritis. Okay? No problem. Last speaker. Yeah. Can you come back? Yes. Now, 61, most of you said C, excellent. Cervical spine. Atlantoaxial subluxation is most common. What is the joint involved in the rheumatoid arthritis? Except. Question number 62. Should your answer? Question number 62. Joint not involved in rheumatoid arthritis. 62. Excellent. Excellent. Ram Krishna, Vishnu, everybody. Everybody. See how aggressive you are. Come on, Gulam Bird. Mera heart mat break karo. It is the dip. Dip is in psoriatic arthritis and osteoarthritis. Whereas PIP, MCP is some rheumatoid arthritis. So, wrist, MCP, PIP, elbow, knee, ankle, MTP. That's what you need to remember. Now, swan neck deformity kahan dikhta hai aapko? Question number 63. Easy question, but it is the way. Easy questions only we should diagnose which topic you are good and bad. So, keep playing quizzes in the UMedico app. Quizzes are all free and आप टॉप 20 टॉपिक्स में मेरा हेल्थ कैसा है एक बार आपका पल्स चेक कर लो उसमें टॉप 20 टॉपिक्स इन द क्विजेस इन द यूमेडिको ऐप ओके एंड इफ यू आर फीलिंग लिटिल shaky just revise once more play if your score is 8 by 10 say antim darshan to the topic and then go ahead. That is how the next 10 days with the quizzes in the UMedico app you should be able to understand what is the fast pointing of your strategy. That's the only strategy. The most important strategy of the life is to know where I am good and where I need to quickly improve and where I cannot improve within this short period of time. वो समझ में आना आपको. That is very important. Okay, doc? So, swan neck deformity is in rheumatoid arthritis. Deflection, PIP hyperextension. So, it's an example of a swan neck deformity. And boutonniere में क्या होता है? Extended dip होता है, PIP हो जाता है. Flexed PIP is what you need to remember. This is the boutonniere's deformity and the Zug deformity of the thumb also. You should be in a position to recognize the Zug deformity. The last topic, जिसका अंतिम दर्शन आप करके you should tell the examiner, I am ready with 20 weapons. Come on, let us have a fight. That is how you should approach in the tomorrow's exam. आप 10 क्वेश्चन देने वाला हूं, मैं 20 टॉपिक्स में तैयार हूं, देख लेंगे मैं कहां हूं, आप कहां हैं. So, if you are confident, full depth, examiner will think, oh my God, out of 10, 8 questions out of 10 he did right in orthopedics. You are the topper in the NEETPG 2019. Simple, very simple, right? Now, amputation. Let's talk about this. In flap method of amputation, which structure is kept shorter than the level of the amputation out of all these? Is a very, very important question. Should you answer, doctor? Yes. Very important question. Very good. The vlog life is proposing C. Naru bol raha hai. Ritvik also bol raha hai. Naru. So please don't forget. सब्सक्राइब बटन करो और बेल का साइन भी मारो ताकि आपको नोटिफिकेशंस आएगा. If you really liked this session, please give me a feedback. You can post it on the UMedico app. Then before exam, we will try to do more number of every subject. 2-3 घंटे में आपका MRI scan करेंगे. How good you are along with other group of classmates, so that you can quickly go for rehearsal. Please let me know that you want more number of this kind of sessions on each subject quickly. 2 hours में decide कर लेंगे हम कितना है, examiner कितना है, right? So it is the bone is what you need to remember. So this is how the bone is kept shorter than the level of the amputation. So, um, in case of partial amputation, when there is a heavy contamination, what is the first step in the clinical management? Uh, very good. Commandant बोल रहा है एक hypoglycemic state में 25% abnormal dextrose के जैसे चढ़ रहा है. That is right, doctor. The whole idea of the quizzes in the U-Medico app is to give you auto testing. Auto testing के लिए motivation रहना. 200 स्टूडेंट्स पूरा देश भर बैठ के करने में और मजा आता है, राइट? सो दैट्स द रीजन आई एम रेडी नेक्स्ट 7-8 डेज में मॉर्निंग में एक दो सब्जेक्ट्स का स्कैनिंग कर देंगे और अंतिम दर्शन करेंगे. अगर आप बोले तो हम भी तैयार हैं नेक्स्ट 7-8 डेज. प्लीज लेट मी नो. सो इन दिस लास्ट मोमेंट में आई डोंट नो बोल के अगर हमको समझ में आ गए तो किसी चीज के बारे में डिप्रेशन आता है. बट आई डोंट नो, but 2 out of 5 questions, but 3 out of 5 still I know. So no problem. I will quickly finish 20-30 minutes and then I will become 5 out of 5. अगर वो हो गया तो it is very easy for you. That's the only help as a teacher we can do to you, right? That's very important. So question number 65. Question number 65. Thank you, Monica. So as the best classes, that's right. Teaching to साल भर करते हैं. साल भर we will across the year I'll do revision for you. But now I don't want to do a lot of revision. I want to check how good you are, how bad you are. So yeah, can you please yeah. So in case of partial amputation, wound irrigation and debridement, that is the most important thing. So remember 3 D's for the indications of amputation. Dying bone, dangerous, that is lethal sepsis or malignant, and a damn nuisance like gas gangrene, crush syndrome or a severe malformation are all the indications. विपुल चौधरी कहता है कि नेक्स्ट ऑप्स गाइन के बारे में करेंगे. डेफिनेटली वी विल डू दैट. एंड ऑल्सो रिमेंबर commonly used prosthesis, examiner will ask you PTB prosthesis below knee, Canadian Sims prosthesis for Sims amputation, and shoe fillers for the partial foot amputation is what you have to remember. So there is one more topic we will try to finish. Colles ke bina examiner, Colles is also very high yield topic. Let me also check that. Colles fracture is, what is your answer? Question number 66. Should your answer, doctor? 66? Yes. Yes. Question number 66. Biswajit, Sahu, Maunika, Sushmita, everyone is saying C versus A. Common in elderly women, absolutely. Distal end of the radius, corticocancellous junction, 2 centimeters from the distal articular surface is what you need to remember. Elderly falls on an outstretched hand, X-ray of the film is being shown. Classical question in the tomorrow's exam. X-ray देखने का भी जरूरत नहीं है आप. Colles आने वाला है because it is in the top 20 topics. That's the reason what is going to be your answer, doctor. Dinner 4 कहाँ होता है? Classically, the Colles fracture. So you should know the set of displacements: dorsal displacement, dorsal tilt, lateral displacement, lateral tilt, and supination is what need to be remembered. So this brings us to the end of the most common high yield topics, doctor. So out of these 20, tell me how many of you got 4 by 5 in all these 20 topics? Most sure short topics में all 21 topics में 4 by 5 किसी को आया है तो बोलो, फटाफट बोलो. I want to listen that good news from you. Yes. So some of you might have got it. So just improve upon where you are really lagging behind. So if there is a morning class, definitely we will update you. and we will try to finish as many subjects. This Antim Darshan ki कार्यक्रम खत्म करेंगे. Thank you very much, and please support this program by donating if you really liked this class, and tell to your fellow friends to also join for the tomorrow's class and to subscribe to the channel. Thank you.